Welcome to Possibilities Beyond, a podcast where we look past labels, limitations, and expectations. Here we explore truth, life, human experiences, and what is still possible. I'm your host, Renee. I'm very excited about the guest that we have joining us today. She'll be joining us via Zoom. She is the CEO for Bellevue Hospital, which is the only psychiatric hospital in Jamaica and #1 psychiatric hospital in the English-speaking Caribbean. She's also the host for Mindset. Her name is Suzette Buchanan. Thank you for joining us, Suzette. Today's conversation is a continuation of our mental health series. We want to be able to bring forth awareness to mental health as it relates to on a broader spectrum, but today we're going to be focused on mental health in Jamaica. What does mental health mean to you?
Thank you for having me, Renee, and to your viewers and listeners. Thank you so much. It's just everything. It's just good health, period. I mean, there is no health if you do not have good mental health. You know, you'll work so hard and to amass all this wealth and just to travel the world, but you, in the midst of everything, there's something that is really important and crucial is good mental health. And one of the things that I've observed, Renee, is that we focus a lot on everything. We want to make sure that we have that BMW when the time comes for it to be serviced. When our children are going back to school, when we're going back to work, we want to go to the ophthalmologist. We want to go get the mammograms done. And once you get to a certain age, you want to ensure that you have the colonoscopy and all of these things done. But you do not do mental health screening. And that is very, very important. So it means absolutely everything.
Absolutely, because if you're not mentally well, you can't be physically well. You might appear to be so, but it's a silent battle that oftentimes we as individuals fight. The purpose of Possibilities Beyond is to, bring awareness, but most importantly, showing that there's possibilities beyond any diagnosis. And we talk about mental health, which is a very broad topic. We're talking about, just about any diverse ability as it relates to your mental health. Um, One thing that I've been doing is watching your social media, your Instagram, and I see your skits. And tell me some more about the skits that you have on social media and what you're aiming to be able to do with those.
When we approached the end of 2025, I met with my social media, with my marketing manager, public relations manager at Bellevue Hospital, and I said, we have to reach. I mean, and know that it is difficult to reach absolutely everyone. That's why we came up with Mindset, and that would have been a national platform. But we understand that on social media, on the social platform, there's a whole new world to tap into. And so we looked at just some of the things that the innovations over the months and over the year, and we look at the reach, and we said, you know what, when it comes on to mental health, there's nothing ordinary about it. So we have to be a little extraordinary. And I said, you know what? I am just going to be the face of it. It's going to be a one-man band, and I'm going to do what is entirely necessary to reach just as many persons as I can. So it is in light of that conviction and that commitment and just championing from day one. I said, listen, I am going to be the face. I have done some little theatrics in my life, some drama and so on. So I said, listen, I'm going to use that. And of course, I'm going to use patois to ensure that everybody understands. So moving into 2026, you'll be seeing a lot more of this on my social media pages and of course on Bellevue's pages. So we have to reach, we have to spread the message. We have to just tell Jamaicans and persons all over the world how you're able to identify signs, treatment for pathway for treatments, right? So referral pathways rather. Yeah.
That's
So
quite refreshing to see because sometimes when we think about mental health, especially on a Jamaica level,
when we talk about, we don't, as a matter of fact, we don't use the word mental health. It's something new now to our vocabulary. What we really talk about is an individual being mad. And then
Yes.
we put when we put a face to it now, it's usually those persons on the street, and we might make fun or we might think that this is unique to them. But I love your skits because we're talking about now like the broader spectrum of it. We're talking about the fact that mental health doesn't just affect those who we see on the street. It's something that affects everybody. So tell me about how how is it looking in Jamaica as it relates to like individuals who are asking for help or, coming for evaluations and the screenings that you talk about?
Renee, just to take it back early on, you mentioned about just, how do we tackle it and just what the skits represent. But I want you to observe also that I was very intentional about using the word living with mental health condition. So I'm trying to change the narrative. So
Yeah.
that's where it even begin. But where mental health, as a hospital, we are the only psychiatric hospital in Jamaica and the leading one in the English-speaking Caribbean.
Mm.
Let me give you a picture of what is at Bellevue now, and then you'll understand where the stigma is. And this will answer some of the questions or invite new questions.
Right.
We are a facility that is 165 years old, and we have a total of 500
Mhm.
patients at Bellevue, and of that amount, 400 represent social cases, meaning 400 persons have been brought here and forgotten. Some have been here for 30 and 40 years, 50 years, right? And they're occupying bed space that could pretty much serve some of those who are on the streets
Yeah.
and other part of Jamaica that needs help. So as a hospital, there's a lot more we could do if persons understood and they were more educated
Yeah.
about mental persons living with mental health condition, because your last memory of that individual is them in a manic state. And
Right.
when you leave them here, you don't want to come back for them. So
Right.
people are still not processing that living with a mental health condition is like any other illness that is controlled with medication. And once you're stable, you can be functional, you can go on to live your life. And they do not understand, as I've said in one of my skits, that the pilot flying the plane, he probably have bipolar disorder, but him on him medication. The
Yes.
policeman in the police car, him probably schizophrenic, but he's stable,
Right.
right?
Hmm.
So I think there's a lot to be done in terms of education in Jamaica. Little by little, we're achieving that objective, and I must commend the team at Bellevue Hospital in just being intentional moving into 2025 in educating the populace on mental health conditions and how to get treatment and how it manifests. And then moving into 2026, we have also stepped it up a notch. So we are doing our part. I think the series that I've started, I am extremely happy because I woke up this morning to 1,500 messages. And I'll say about 70% of these messages, they're saying, listen, how do I get help? Yes, I'm guilty of adding to the stigma as it relates to Bellevue. What can I say differently? My brother, these are the symptoms. How can I get my brother into the institution, or how do I begin the process of getting help? What do I say to him? What do I say to my sister? My sister, she's been going through postpartum depression for 6 years. Can somebody go through postpartum depression for 6 years? So these are just some of the questions that I am getting. How do I begin? How do I say to my sister's husband that this is actually what is happening, because he's in denial? What do we do with the children in this period? How do we come to the hospital? Can we just walk in and get treatment? I'm truly happy that we are in fact getting somewhere.
Absolutely.
So it's not looking bad, but there's a lot to be done. But it begins with education.
Exactly. And as long as we start somewhere, and since you mentioned that, yeah, talking about living with mental health, It's and that's a possibility beyond the diagnosis that we want to get to. Talking about that, we can live regular lives, with our mental health conditions or a mental health diagnosis. Do you find that more people, I know you did say people are reaching out, but do you find that with the stigma that's attached to mental health, do you find that more people are looking or seeking to be treated for whatever condition that they're going through?
We still have, it's still taboo, I must say, but we still, with the work that has been done, and certainly the Ministry of Health and Wellness, they have been doing their work as well. And there are private Jamaican service clubs, schools that have been reaching out to us, and we have been reaching them, I think a lot more persons, we're certainly not where we, at least I'll say, easily say 4 years ago. I can't speak. I wasn't that zoomed in until I was at the institution. But certainly when I look at the numbers, when I came here, we were talking about 400 coming to our emergency room for the year. Now we're over 1,000 coming in that we're seeing. So it tells you that there's data and statistics to support that more persons feel more comfortable to seek help. And as for our men, we're seeing an increase in that because as you're aware, men have poor health seeking behavior.
Yes.
And so much so that when they come to the institution, they spend way longer than the female because they would have been in an advanced state.
Yeah.
So we are seeing those numbers going up for our men, and we're seeing our general numbers going up for the institution as well. So that is proof and testament to the fact that there are several initiatives, not just as the hospital, but Jamaica in general. They are working, and more persons are presenting themselves to the institution. So that's a good thing.
Prior to us coming on, you spoke about early intervention and what the world of difference with early intervention. So let us talk some more about, what if we had caught it at its early stage? How differently would it look?
Wow. Renee, that's an excellent question. Truth is, the place I'd want Jamaica to be is where we incorporate our mental health evaluation and screening in just all the checks that we do on an annual level.
Yeah.
The place that I'd like to see mental health is where we have conversations around the dining table with the little ones about being kind and just how kindness will impact someone's mental health in a positive way and certainly impact their own. That's where I'd like the conversations to really begin.
Yeah.
But having said all of that, I'm hopeful and I know we're going to get there. But early intervention is key, not just when it really comes on to breast cancer or prostate or anything else, or people want to get their colonoscopy done by their 50. It's the same thing that applies to a mental health condition. Most mental health condition, it shows up within those adolescent years.
Yeah.
So as parents, we have to know those signs. And people like to say government not doing this. We have a responsibility to our children also to educate ourselves.
Yes, we are.
We have a responsibility to our communities to educate ourselves. Because if you have somebody living with a mental health condition 2 houses from you, it's going to affect you up the road. Because he's going to run up there and throw some stones at you as well.
Yes.
So as a community, we have to be more proactive. As a family, we have to be more proactive and be more intentional towards our attitude when it comes down to mental health. Because as I mentioned before, without good mental health, you have no health at all. And so the more conversations around those dining table, more conversations in schools from those early years, and know the signs so you can begin to look out for them. And as I mentioned, they show up in those adolescent years, whether they start with depressive disorder, the most common mental health condition. And according to the World Health Organization, it takes its time moving around and is becoming the number one illness. And mental illness is becoming number one. So it's a number one non-communicable disease illness that you have. It's heading there if it's not there yet. And so there is a need for us to identify these signs early. And one way you can identify signs is know the signs and see your therapist.
Yes.
Early intervention can save life. It can save mine and it can save yours. Because when you have thoughts of suicide, sometimes it's homicide. You want to take somebody else with you. So that's the extent as well. And so it is important for you to know the signs, and early intervention can in fact have you live a healthy life, because it starts with depressive disorder, anxiety, which is very, very common. Number one, as I've said, depressive disorder, anxiety. And it goes untreated, Renee, and then it becomes bipolar disorder. Then it borderline schizophrenia. It becomes full-blown schizophrenia. The longer you take to be treated, it's the more advanced it's going to get, and it's the more likelihood that you're going to spend a long time in Bellevue. It's more likely that your family, they're not going to want you around them anymore, because you're going to have more manic episodes, and persons will now view you as aggressive and don't want you around. So it's important. Early detection is very, very important. So folks, you want to learn what those signs are and begin to look out for them and seek help for your child or your husband or your wife.
And since we're there, tell us some of the signs, some of those signs.
All right. So let's just talk about it. Parents will complain about, oh Lord, she just rebellious.
She just bad.
It's because we never make she use the computer the other day. No, it's not that. The child is trying to, in a language that she believes that you are likely to understand, because you have already made a pronouncement. Oh, she's just attention seeking. So she's trying to get your attention by probably just carrying your brand new iPhone to school. Rather than you say she thief and she lie and she wicked, you just say, listen, why? And probably have her talk to a therapist. Another thing, so we talk about the stealing and the lying, you know. Another thing that we need to look out for is if you are somebody that is up and about and you become withdrawn, and I'm speaking for adults, husbands and wife as well, don't readily assume again, Lord have mercy, she not pay me no mind again, a man she having or a woman she have. It could be that she's going or he's going through something. So if you become withdrawn, locking away in your room and not wanting to have any conversation, or just caught up in this game. Boy, it's a game head. Me having, you know, none of the boy man is a game head. It's not a game head. He is just, whatever is happening, he's not comfortable to talk about it. So he's going through that activities. If you have somebody that is usually up and about and go to the gym and go party or go to all of the festivals, and then you see them become withdrawn. Now there might be something going on. Usually eating again. If we eating habit change, it can be eating more. We probably used to eat a lot and we start eat less, or we used to eat less and we start eat more. Some persons, when they are going through stress, they eat more. Some persons, they eat less. That's something you have to look out for. Excessive talking, that's another thing too. Might make you say, something wrong. Oh, she talk so much, like something do her, or something no do her. Or talking less. This person used to be talking, this used to full of life. That is something you want to look out for. As for those adults having intimacy, let's talk about intimacy. It's quick for us to judge. Once that happened, Lord God, upon me, I get no, some I don't know where I get the money from. Yeah, or this woman. Sometimes they are going through distress. So those are just some of the signs that we look out for. Now carry yourself good. Lord God, you used to be well dressed and in your jacket and your tie, you come and work like a draw and slippers, matter in your yaya and all of them, something there. It's then you realize that person said, but wait, but Renee, we used to dress up and look nice in our off the shoulders and our nice little earring and our ear curl up. That no look like Renee. The house, I love your set, by the way. Somebody see the house and I said to them, says, listen, but Lord God, they know where Renee have all of them and something I throw down here. So it is speaking. While this person is not saying anything, you are able to pick up all these things. So these are just some of the signs. And then one of the biggest one that we tend to ignore is that you can look, probably somebody get extra happy. Extra happy at the wait. That tells you that that person is masking something now, Renee. Person just happy. Oh, Lord, this is just a beautiful day. And I'm just glad to be in it. Oh, my, laughing at jokes that are not funny. You say, what is this person masking? And talk doom. Oh, nothing works. I don't know. I've been studying for so long. I'm not passing my test. I'm at a 90. And I mean, I used to be at a 95. I mean, I'm not going to get anywhere with this thing. I'm not going. just talk of everything. Oh, I'll never get a job in corporate Jamaica because I'm too ugly for that. And just giving away things. The next thing too, when you see somebody start to give away some lovely things, them have their Rolex watch, and them start to ask, where's my favorite niece? I'm gonna give it to you. That's a sign you can look out for. That person is being depressed. They think they are a couple days shy of living. They don't see the reason for living anymore, and they just want to end it all. So those are some signs that we can begin to look out for. And when these signs happen, I know you might ask, how do you respond to it?
Yeah.
You might be
That
seeing
was my next
signs.
question. So
I know,
go
I
right
know.
ahead.
You've been on the ball so far, so I
Yes.
knew we were gonna get there. So one of the things that you can actually do is you don't want to impose yourself too much. You don't want to be judgmental. You don't want to be forceful. You can't say to the person, but no, man.
Fix
Yeah,
up
oh, you,
yourself.
look here. So yes, man, get yourself together, man. Yeah, throw things in a God face. Look how God good to you. You have your house, you have your husband, you have your car. Depressive disorder is sometimes solely biological. So it not have nothing to do with all the worldly possession you have. There is just something happening with the frontal lobe,
Yeah.
and that is it. And it runs in the family. So you want to go to that person and say, hey, just reach out. And you cannot be just breathing down their throats. Give them time and give them the opportunity and room to accept the help from you. But you just want to let them to know that you're available. And sometimes it takes to just ask them, how are you?
Yes.
What is going on? Are you okay? And see if they'll tell you. So if they don't tell you, simply say to them, you say, listen, I am here. I am here for you. Pick up
Present.
the phone and call me when you want to talk if you need to do anything. And we can't be judgmental. And sometimes we have to watch our language. We can't go to people and want information from them and make it look like, oh, that never happened to it.
Yes.
Sometimes some of us who lie and dishonest and go on like they live a life of they're afraid to admit
Perfection.
so
Yeah.
somebody else can be comfortable. So I go to somebody and say, listen, I noticed this about your daughter. I can relate because I have my daughter that has been living with bipolar disorder for the past 13 years. And so I do understand what she's going through. People must be able to see a reflection of themselves in your eyes. And too
Right.
many of us are carrying these burdens that we don't want to talk about it. Even if we see somebody dying,
Yeah.
if we see a neck in the news, we want to keep it hush hush because it makes us look better. But we need to give language that they can relate to say, hey, and know that you are life and its journey can be so much sometimes. Because the other day when I was going through so much, Renee, I had to go and sit and talk to my therapist, and I'm feeling so much better. So I'm saying sometimes we as women, we just have to do it. So when you're ready, let us do it together.
Yeah.
Those are language that they likely respond to because nobody wants to feel like they are being judged. And
Yeah.
so, the next thing that is important, if you give your commitment, keep your word.
Yeah.
Somebody just say them want help you because it sound good and it sound good for them go back. Then repeat it and say, Shannon did come to me the other day when me never feel good and say she want help me. Well, she really nice. But we only say it out of our mouths. If you
We
give
need
a
time.
commitment, keep that commitment. Say,
Yeah.
listen, hey girl, I'm gonna pick you up at 12 o'clock and we do something. Let me tell you something. This morning I got a call from a young lady and she said to me, hey, Miss B, can I come to the U Park, which is a beautiful garden? When you're here next, please come and see. Chat can tell you about it. But I said, what happened? She said to me, my friend, she's not feeling well. And so I want to come and connect with the earth. I want to come to a space where I can sit and just, 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 just soak up the atmosphere, listen to the sound of the, 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 the trees and the bees and the animal and all of that.
Yeah.
That's how it actually worked. And so that was an intervention right there. And when I came to work, they were here in the park and
So
she was both studying and the young lady was leaving a while ago. You could see it in her face that she was happier.
yeah.
So these are just simply interventions. And hey,
And
don't want to chat you out too much,
that's
but
okay. I'm hearing you talk, and for some reason we're running out of time, and this conversation is too good to cut short. But I'm hearing you talk, and it's bringing me back to my childhood. And I know you said that some disorders are biological, but some of them are triggered by trauma. So
yes,
what do we say to the young girl, or just because the mental health doesn't necessarily have an age or a specific face or specific race or gender. So my earliest years with dealing with mental health was because I was molested as a child. I remember it happening as early as 5 years old. And though I don't think I was confused, I didn't know what was happening. I don't think it manifested itself at 5, but I remember, getting into adolescence, getting into teen years. That's when, just like you said, they start saying the pitney bad. I acted out in school. I was not a good student, I can tell you that, because I was crying out for help, but no one saw the signs. What do we do as, I know you said you did explain the signs already.
Well, one of the things is trust is so important. And a child that has been abused, they not trust adults anymore.
Mhm,
We have been brought up as children to be so unkind to each other.
mhm.
So I think one of the things that, and it comes back again, Renee, to identifying signs. You
Yeah.
have to be able to identify signs. Sometimes I was sitting in a room with a child that was abused, and I quickly picked it up based on when certain discussions came up, how she avoided it and she wouldn't look up in my face. And when I was finished with the interview, I was having a discussion with a group of children. I pulled one of the caregivers aside and I said, check out this child. Something has happened with this child. So that's another thing. We have to look at signs. If a child is overly aggressive,
Mhm.
then you know that there's something going on there. If the child is not giving you, keeping that focus, or if when certain subject come to the forefront, that child avoids it, walk away, swing the chair, turn around, then you have to look, you look how that person interact with the male, and see how, and then those are ways you can pick up sign. But as I mentioned, trust is a big factor when it comes down to these things. So
Yeah.
if you are aware, if you see these signs, you want to likely then want to speak to somebody that's independent. It can be a pastor,
Yeah.
you know. That is usually a good start, because especially Jamaicans who were brought up to with so many churches per square mile to believe that Jesus is the answer, which in fact Jesus is the answer. That's a good start. You want to say to them, is it okay for you to talk to your pastor? Because we were brought up to know that pastors is somebody that you respect, somebody who the child love, or somebody that you hear the child talk about. Sometimes that person is not within your household and it's not your neighbor. Sometimes it is. This is where the community becomes involved, because it might be the CEO at Bellevue that you see on social media. Somebody called me this morning and say, I have a 10-year-old daughter and she admires your video. Can you send me your number? And I sent the number and I'm in communication with them. No, I'm talking to the little girl. So I'm saying to you that sometimes that person who you need for that intervention, when it comes down to something as sensitive, it's not necessarily your neighbor, your friend, or your auntie, your uncle. Because your family member and those close them are always the last person to know. The mother is the last person to know that you've been molested. But find somebody who the person revere. You hear them talk about who they respect. And then the next thing that you can try is that with the advent of social media and online this and online that, you have apps. I want you guys to use technology. We've been using technology for so many things. They know that it is AI that they're communicating with, but AI gives you some tips. So
Yeah.
you can introduce the person and say, little Renee, sometimes all of us go through stress,
Yeah.
and use relatable language. At one point, that's something that I've tried already. I've said to somebody, I know what you're going through because I've been touched inappropriately. I told them, I said, I was not molested. Those who are around you are always the last person to know. I recall growing up as a child, while I was not penetrated, but
Mhm.
I was touched inappropriately. I went to my grandmother's boyfriend to drop off food, and he touched me. And I remembered that throughout my life. And I told no one, I told a total stranger. And since I became an adult, I spoke about it like a couple of years ago, but I remembered it.
Yeah.
So sometimes you want to say to that person, you want to use relatable language. You want to say to that person, if you see somebody going through a crisis, say, boy, little Shannon, I know you've become a little bit withdrawn. That's how I was too. I was touched inappropriately. I'm not saying that is your case, but I mean, we've all gone through this. So people need to understand that you're not judging them because you have walked the same walk and they feel that they're more comfortable. So that's one of the first steps. Find somebody that these persons are close to, that they're comfortable with, somebody that they respect. We are a cruel society, but we're not as cruel where if you reach out to the manager at NCB and say, listen, go to the secretary and say, my daughter admires you, Mr. Leachin, and this is what I think has happened. Will you spare a minute or two?
Yeah.
I'm sure he will.
Asking for
Right. So
help.
that's where trust is. So start there. Start there with somebody. Use relatable language. Start with look around and see who they trust, who they watch on social media. It could be Rose and Akeem.
Yeah.
And you pick up the phone, you touch Rose, and probably Rose can say, oh, this has happened to me.
Yeah.
And probably Rose can reach through to that person, just to mention. It can be a Lisa Hannah that is on social media. Everybody loves the beautiful Lisa Hannah with these gems that she's dropping every day. I'm sure she won't miss that opportunity to make a difference in somebody else's life. So that is usually where you start. Somebody with your trust, somebody. Yeah.
Somebody says, be careful of what you put out there on the internet. You know, when I was saying I was going to speak about this, and I've spoken about it openly before because it happened to me. And I know that a lot, maybe more than I can even think of, a lot of people are going through it right now and are afraid because us as family, sometimes, and we're too judgmental, we're the first to judge, or even sometimes it's not coming from a place of judgment where you're feeling like you failed. You know, I failed as a mom. How come that happened? You know, so I admire and appreciate the work that you're doing. I think we should continue to have this conversation. But before we close off, I want to say, you know, what are your hopes for Jamaica and the wider world when it comes on to, you know, advocacy for mental health or awareness or even acceptance? What are your hopes?
You know, I have been visiting Australia for a couple of years and lived there at once, and I have said that the stigma is non-existent. I would love that model. They have a continuous campaign that is called Are You Okay? Set up in supermarkets. You get pamphlets and persons are there to have conversation. There is the Wellness Wednesdays where a psychiatrist comes into your working environment. You have Wellness Day. My daughter takes her Wellness Day every second Monday. She's at home, and that's where she self-care and pamper, and she gets the opportunity and speak to a psychiatrist. This is almost mandatory. That's where I want Jamaica to get to, a point where we have wellness days, a point where not just Jamaica, but the entire world,
Yeah.
you know, to get to a place where you have wellness days, a place where, I mean, you have those days, all wellness days, and you have days where you have your psychiatrist, and whether a psychiatrist come into the entity, the establishment on given days, like it happens in Australia. That's where. And I want the stigma to be non-existent because the stigma for years prevent a number of persons from seeking the help that they actually need. They don't want to talk about it, you know? So that is where I'd want. And one of the things that I'd want is that a greater partnership and collaboration with the Ministry of Health and the Ministry of Education, and even us as a hospital as it relates to Jamaica. There has to be continuous education at all levels. You know, you have to treat the kids to be kind from basic school, because when you're unkind, when you call people nickname and say, oh, Buckhead, Buchanan, and Roach, Roachy, Roach, you need Roach, she's a Roach, she's a Roach, you smell like a Roach. That's where the trauma begins. You know what I mean? Yeah, look on our fat, buck our fat, big, right. So,
I'm laughing,
right.
but it's serious because that's exactly how we are.
Yeah.
You know, I've been truly blessed to have you on. I just want to thank you. I hope we can continue to have the conversation. I want to thank you for coming on. And I would stay all night and talk to you, but we only have a small time allotted to us. But
And I talk a lot, you know, so I would stay here all night and talk.
me
So
and you, we
it's
will
good to
do
cut me
it.
off.
I really I believe it is possible. I believe the possibility is beyond, you know, what our imagination. I believe that we certainly can, you know, through awareness and through education. I think we can get there as a country, and these are the conversations that we will continue to have. Thank you so much for coming on, Suzette.
Thank you for having me. Blessings.